Escape Next was a study which, we were trying to replicate the results of the prior trial. So in terms of design, we essentially did almost exactly the same as what we did before, with the exception that we excluded those patients who were receiving intravenous alteplase. So in the study, patients had acute stroke. They had proven large vessel occlusions. They were all going for endovascular therapy, and then they were randomized to receive Nerinetide or saline control as soon as possible, essentially. But in general, prior to the start of endovascular therapy, and then followed them through for 90 days to get the 90-day outcomes. And the trial was done entirely during the COVID era. So that was an interesting evolution. But the bottom line of the study is that despite what looked like an interesting effect size in the Escape NA1 study, we did not replicate the results. The results were neutral. So we did not prove the hypothesis that Nerinetide was better than saline control. I think there were a couple of interesting things that we observed, though, that are sort of part of trying to understand, what happened with the study. One was that our outcomes, control and placebo and intervention groups were quite a bit less than predicted. So, in other endovascular trials that are ongoing or were ongoing around before and on the same time without alteplase, we saw outcome rates of about 55% of patients getting modified Rankin scale score of 0 to 2. And that's our standard stroke outcome, right? It means someone's independent and they can get back home and live on their own. And we had 45% good outcomes, despite similar strokes and lots of similarities in the population. And I'm not sure why that is exactly, but the big glaring difference between our trial and the prior trials was COVID. So we wonder whether there was some relationship with the COVID here. And then the second thing is that speed appeared to be important. So we saw that if you do treat patients, and certainly in the earlier time window, there appeared to be an effect size in favor of Nerinetide. And so we hypothesized that maybe, the population we got was just was too late. Doesn't quite, jive with Escape NA1, because in Escape NA1, we also treated some patients late and they also seemed to benefit. So there's something different. There's certainly something different about the population that we studied in this trial compared to what we studied in Escape NA1. And nevertheless, the results are what they are. They are neutral. So we didn't, as I say, it's negative for Nerinetide.